Assalamualaikum everyone, and welcome to the platform of Pharmapedia once again with a new topic of anticholinergic drug. In the previous video I discussed the cholinergic drugs. So what are the anticholinergic drugs? Drugs that block or inhibit the action of acetylcholine in the parasympathetic nervous system, also called as cholinergic blocking agents or parasympatholytics, anticholinergics or antimuscarinics. Now this is the classification of the anticholinergic drug. It is also known as muscarinic antagonist, atropine drug, and parasympatholytics. It have further three classifications: natural alkaloid, semi-synthetic derivative, and synthetic compounds. And the synthetic compounds are further divided on the basis of its clinical use in the four categories. Now the mechanism of action, it is the competitive antagonist compete with the acetylcholine, block acetylcholine at the muscarinic receptor in the parasympathetic nervous system. It is reversible, block the action of acetylcholine at the muscarinic receptor by the competitive binding. Reversible by increasing the acetylcholine or agonist, because it is block or bind with the receptor in the competitive manner. Once these drugs bind to the receptor, they inhibit the nerve transmission at these receptors. This is a mnemonic that how you will remember the anticholinergic drug. So it is tropine alkaloids, include the atropine, tropium, and phenicin is the mnemonic. By them you can easily learn the anticholinergic drugs. Now Atropine is a prototype antimuscarinic drug derived from the Atropa belladonna and the Datura stramonium. History: during the Italian period, it dilates the pupil and it is considered as the beauty drug. Why? Because its extracts were used as a cosmetic eye drop, because it caused the mydriasis and dilate the pupil. Now antimuscarinic drugs action mnemonic, it inhibit the parasympathetic, and so by this mnemonic you can also easily learn the antimuscarinic drugs, that is I for ipratropium, P for parasympathetic and parasympine, A for atropine, and S for scopolamine. Its actions on the different organs are: first I am discussing the cardiovascular effect. It decreases the cardiovascular response to the vagal stimulation, resulting in the tachycardia, mainly tachycardia due to the antagonism of the vagal effect. On the vascular, it have no direct effect except dilate the cutaneous vessels, having the mnemonic red as a bead. It blocked the hypotensive effect of the muscarinic agonist. On CNS, at the normal doses, atropine stimulates the medullary centers. However, at the higher doses, it produces excitement, agitation, hallucination, and coma. It depresses the vestibular excitation and has anti-motion sickness properties. It suppresses the tremor and rigidity of the Parkinson's by blocking the cholinergic overactivity in the basal ganglia. Now in the eye, it dilates pupils and causing the mydriasis. It blocks the muscarinic innervations on the circular muscles and relaxes the ciliary muscles. It worsens glaucoma because by increasing the intraocular pressure. In the GI tract, it relaxes the smooth muscles of the GI, decreases intestinal and the gastric secretions. It decreases the motility and peristalsis. It have antispasmodic effect and increase the sphincter contraction. In the respiratory system, it decreases the bronchial secretion, so it is used as a pre-anesthetic medication and also used in the COPD. It dilates the bronchial airway, so it is used in the treatment of the asthma. genitourinary. It relaxes stream muscles, increase the constriction of the internal sphincter, result in urinary retention. It relaxes the smooth muscles of the ureters, and therefore they are contraindicated for the prostate hypertrophy patients. In the glands, it decreases salivary secretion, decrease gastric acid secretion, decrease sweating, and decrease bronchial secretions. As therapeutic use, when I'm talking about the central nervous disorder, so the Parkinson's disease, it is also used, and the drug uses in the Parkinson disease are benztropine and trihexyphenidyl. Those who cannot take levodopa help in decreasing salivation, spasticity, and tremors. In the motion sickness, the drug of the choice is mentioned in the bold and italic scopolamine. Drug-induced extrapyramidal reactions due to the antipsychotic. Now, in the CVS, atropine is used to increase the heart rate in the symptomatic bradycardia, sinus nose dysfunction, symptomatic second-degree heart block, sinus or nodal bradycardia. In the respiratory system, it decreases the secretion from the nose, mouth, pharynx, and bronchi, relax smooth muscle in the bronchi and bronchioles, and it decreases the airway resistance and can lead to the bronchodilation. Respiratory agents are used to treat exercise-induced bronchospasm, chronic bronchitis, asthma, and COPD. Ipratropium is used in the respiratory system disorders as mentioned as an inhalation or tiotropium. Now, in the GI tract, it blocks the parasympathetic nervous system, result in decreased all the secretion, relaxation of the smooth muscles, decrease the GI motility, and peristalsis. GI agents are used to treat peptic ulcer, and the drug in parasympatholytic as antispasmodic, butyrylscopolamine, IBD, propanthyline, and GI hypersecretory states. Now, in the urologic disorders, antispasmodic effects see in overactive bladder and in urinary incontinence. Oxybutynin and ureasis increase bladder capacity, decrease bladder pressure. Therapeutic use of anticholinergic drug in the ophthalmologic disorder, and the drug use are homatropine, tropicamide, accurate measurement of refractive error in uncooperative patients that are children, and the examination of the retina. These are the anticholinergic side effects which you can learn by this mnemonic. Know the ABCD of the anticholinergic side effect. And what is ABCD? That is anorexia, blurry vision, constipation, confusion, dry mouth, sedation, stasis of the urine. So that's it about this topic.